Prime Minister Narendra Modi addressed a post-budget webinar on the subject of health and medical research on the 6th of March 2023. It is the 9th of a series of 12 post-budget webinars organized by the government to seek ideas and suggestions for effectively implementing the initiatives announced in the Union Budget 2023. Union ministers, healthcare professionals from public and private sectors, and professionals from paramedics, nursing, health management, technology and research attended the webinar. At the outset, the Prime Minister congratulated the health sector for successfully running the world's largest vaccination campaign that has established the efficiency and mission-oriented nature of India's healthcare system. Addressing the gathering, the Prime Minister said that healthcare could be seen in terms of pre- and post-COVID pandemic systems. He said that the pandemic tested even prosperous nations. He pointed out, as the pandemic focused the global attention on health, India went a step further and focused on wellness. That is why we have put forward a vision before the world, One Earth, One Health. This involves holistic healthcare for all creatures, humans, animals or plants. The Prime Minister reiterated the lessons learnt with regard to supply chain during the pandemic and said it has become a matter of great concern. He lamented the fact that life-saving equipment like medicines, vaccines and medical devices were weaponized when the pandemic was at its peak. The Prime Minister underlined that in previous years' budgets, the government has constantly tried to reduce India's dependence on foreign nations and emphasized the role of all stakeholders in this. The Prime Minister said the budget builds upon the efforts to reform and transform the healthcare sector that have been undertaken during the last 7 years. We have adopted a holistic approach in our healthcare system. Today, our focus is not only on health but equally on wellness, he emphasized.
साथियों, आजादी के बाद अनेक दशकों तक भारत में स्वास्थ्य को लेकर एक इंटीग्रेटेड अप्रोच, एक लॉन्ग टर्म विजन की कमी रही। हमने हेल्थ केयर को सिर्फ हेल्थ मिनिस्ट्री तक ही सीमित नहीं रखा है, बल्कि होल ऑफ द गवर्नमेंट अप्रोच पर बल दिया है। भारत में इलाज को एफोर्डेबल बनाना हमारी सरकार की सर्वोच्च प्राथमिकता रही है।
The Prime Minister said through the Ayushman Bharat scheme, about 80,000 crore rupees of the poor patients were saved due to free treatment. Noting that 7th March is observed as Jan Aushadhi Divas, the Prime Minister pointed out that affordable medicines through 9,000 Jan Aushadhi Kendras have saved about 20,000 crore rupees of the poor and middle classes all over the country. This means that just these two schemes saved 1 lakh crore rupees of the citizens. Underlining the importance of a strong health infrastructure for the treatment of serious ailments and highlighting the prime focus of the government, the Prime Minister informed that more than 1.5 lakh health centres are being developed in close proximity to homes across the country so that testing centres and first aid are available. He also informed that facilities for screening serious ailments like diabetes, cancer and heart-related issues will also be available at these centres. The Prime Minister underlined that critical health infrastructure is being made accessible to small towns and villages under the PM Ayushman Bharat Health Infrastructure Mission. Regarding human resources in the sector, the Prime Minister informed that more than 260 new medical colleges have been opened in the last few years. This has doubled the medical seats in graduate and postgraduate medical courses as compared to 2014. The Prime Minister underlined the emphasis on the nursing field in this year's budget. Opening 157 nursing colleges in the vicinity of the medical colleges are a huge step in the direction of medical human resources. The Prime Minister highlighted the role of technology in constantly making medical services accessible and affordable and elaborated on the government's focus on the implementation of technology in the sector. Through the Digital Health ID facility, 10 crore people have already benefited by teleconsultation through schemes like eSanjeevani, he said. 5G is creating new opportunities in this sector for startups. Drones are bringing revolutionary changes in medicine delivery and testing services, exhorting the entrepreneurs to avoid the import of any technology. The Prime Minister spoke about the new schemes in the medical device sector. He mentioned bulk drug parks, medical device parks, more than 30,000 crores on production-linked schemes, and said that the last few years have witnessed 12 to 14% growth in medical devices. He informed that this market will reach 4 lakh crore rupees in the coming years. The Prime Minister also said that India has started work on skilled manpower for future medical technology and high-end manufacturing and research. He said institutions like IIT will have courses like biomedical engineering. He asked the participants to find ways of industry, academia and government collaboration. A new program is being launched to boost research and innovation in the pharma sector through centers of excellence, which will strengthen the economy as well as create new opportunities for employment, said the Prime Minister, and added that the market size of the pharma sector in India is 4 lakh crore rupees today. He stressed the need to find coordination between the private sector and academia, as it has the potential to increase the market size beyond 10 lakh crores. The Prime Minister informed that many new labs of the Indian Council of Medical Research have been opened up for the research industry. Mr. Modi noted the impact of the government's efforts on preventive health care. He listed Swachh Bharat Abhiyan for cleanliness, Ujjwala scheme for smoke-related diseases, Jal Jeevan Mission to tackle waterborne diseases, and the National Poshan Mission is addressing anemia and malnutrition. He also mentioned the role of millets, Shri Anna, in the International Year of Millets. Similarly, PM Matru Vandana Yojana, Mission Indradhanush, Yoga, Fit India Movement and Ayurveda are protecting people from diseases. The Prime Minister noted the growing global acceptance of Ayush and exuded pride in the fact the WHO is going to start its only global center of traditional medicine in India. The Prime Minister underlined the efforts made by the government from modern medical infrastructure to medical human resources and said the new capabilities are not limited to health facilities alone for its citizens but also aim to make India the world's most attractive medical tourism destination. He pointed out that medical tourism is a very large sector in India and also becoming a huge medium for generating employment in the country. The Prime Minister stressed that a developed health and wellness ecosystem can be created in India only with Sabka Prayas or everyone's efforts, and requested all stakeholders to give in their valuable suggestions. He said they should be able to implement the budget provisions within the time limit for decided targets with a concrete roadmap. Concluding the address, the Prime Minister told the participants that realizing all the dreams on the ground before the next budget while taking all stakeholders along will require the benefit of their experience.